Well, I remember in Cape Town, or the Western Cape, in the last wave, we were all feeling pretty stressed out at about this time. Let's find out more from the situation in Gauteng from Aviwe Mtila, eNCA senior reporter. Aviwe, thanks for joining us. I remember at a time in the second wave where we were feeling very anxious at about now. What's going on the ground in Gauteng?
Concerns, eNCA, as the third wave officially hits Gauteng. We understand that around 64% of the infections that are recorded are from the Gauteng province. And to add to those woes, the DA claims that the city of Johannesburg has suspended its emergency ambulance services. But just to get more on this, I am joined by the Democratic Alliance's Jack Bloom. Thank you for joining us at eNCA. Suspended services, how bad is the situation? Do we then have ambulances in the city of Johannesburg?
Well, we've got provincial ambulances, but there were city ambulances, 40 of them, and they were absolutely needed. Now we have a situation at Kuruleni where they've also got ambulances, but none of them are being used because of the provincialisation process. You know, the Gauteng Health Department is taking over all the ambulances in Gauteng. Only the city of Tshwane is operating its own ambulances at this moment. So unfortunately, in the middle of this terrible epidemic, we're having a shortage of ambulances and delayed response times. It's really very, very concerning, and people are suffering.
What are the reasoning behind the suspension of these ambulances and the concerns around the response? If someone calls now needing an ambulance, how long will it take to receive one?
Well, in my experience, because people are contacting me increasingly about calling for ambulances and they never arrive. According to the city of Johannesburg, it's insurance concerns and lack of medical supplies. But, you know, really, I think the problem is the provincialisation of the ambulance services by the Gauteng Health Department. They really need to give an order to all the cities that still have ambulances. Use the ambulances you have, the personnel. We're in an emergency situation. People are dying, and we need to get them to hospital as soon as possible with all available ambulances.
Okay, we're in the middle of the third wave in Gauteng with the Provincial Department of Health calling for a higher level for the province. I mean, to add on to those woes, there's also Charlotte Maxeke Hospital, which is currently closed. What then do we do going forward to navigate the situation?
Well, I think obviously people must be very cautious in their behaviour, because that's the prime thing that will stop this epidemic. But we can't go into this epidemic with the Charlotte Maxeke Johannesburg Hospital closed. So I've called for an urgent debate in the Gauteng legislature. We need to know what are the reasons why this hospital is still closed. It's a 1,000-bed hospital. It's got ICU units that we need for COVID-19 patients. According to the Department of Infrastructure Development, large parts of the hospital are structurally sound. What is the delay? I think we need to find out why it's not opened yet, and use emergency procedures, if necessary, to reopen the hospital.
And then just quickly your thoughts on going up one more level for the Gauteng province, a stricter lockdown level.
Well, I think it's a balance of factors. It's lives and livelihoods. And really, at the end of the day, I think the key danger factor is indoor gatherings, because that's where the virus spreads most, and super spreader events. So I think they need to consider all the factors. But one of them is that we need to have sufficient hospital capacity, and we can't do that with the continued closure of the Charlotte Maxeke Johannesburg Hospital.
Okay, thank you very much. That's the Democratic Alliance's Jack Bloom talking, among other things, about the Charlotte Maxeke Hospital, which is currently closed because of the fire that ripped through. And of course, this is very concerning, given that we're in the middle of the third wave in Gauteng, and essentially calling for a debate in the provincial legislature just to delve on how that situation can be navigated in Gauteng.
Sure, Aviwe, that sounds like a perfect storm there, with limited ambulances and one of the main hospitals closed. Thanks so much, and please keep us updated.